Madam, good evening.
Good evening to all. Good
evening, madam.
Retd, thank you very much. For a familiar faces, those who are showing their faces.
Shanda mute edegwa. Shanda mute edegwa. Madam, അത് മ്യൂട്ട് ചെയ്തിരിക്കുക മാഡത്തിന്റെ മൈക്ക്.
ക്ലാസ്സിൽ ജോയിൻ ചെയ്തിട്ടുണ്ട്.
Left corner, top.
Good evening.
Good evening, doctor. So, Shanda madam, do you wish to speak for a few minutes? Dignitaries join chain the madam, maybe 5 minutes. Okay, okay. Then, yeah. Then we'll officially start the function. Okay. So, the dignitaries have all joined. Now it's time to begin the official function. A warm good evening once again to one and all. Today, 4th February is World Cancer Day. More than just a medical diagnosis, we all agree that cancer is a deeply personal matter involving grief, pain, healing, resilience, love, and more. Conquer Cancer Consortium, comprising charity and service societies, was formed last year to work towards a common objective. The member organizations are Indian Medical Association Trivandrum Branch, Indian Dental Association Trivandrum Branch, Pallium India, Snehita Women's Health Foundation, YWCA, YMCA Trivandrum, All Kerala Blood Donor Society, Inner Wheel Club of Trivandrum Blossom, ASMIC, Center for Preventive Health, Ashraya, iCare Charitable Trust ISRO, Care Plus, ISRO Women Employees Benevolent Forum Web, Wiseman International, FRAS, Women's Dental Council, Family Planning Association of India, and Solace Mission. The activities of the consortium include public screening camps, vaccination drive, and awareness talks. Representing iCare and Web from ISRO, I, Anjana, welcome all the members who have assembled online to observe World Cancer Day 2025. The theme for World Cancer Day 2025, United by Unique, focuses on a people-centered approach to cancer care, integrating each individual's unique needs. People are placed at the center of care, and their stories occupy the heart of the conversation. The 3-year campaign from 2025 to 2027 will explore new ways of raising awareness to taking action with compassionate empathy, leading to the best health outcomes. It is heartening to note that Kerala State is launching a campaign today, which will last till the International Women's Day on March 8th, to create awareness among public and conduct screening programs for early detection of cancer. Today's proceedings will start with a prayer song by Srimati Camila.
മലകളെ നിങ്ങൾ തൻ ഗൗരവ ശൃംഗത്തിൽ മഴമേഘമുടി വച്ചതെന്നും നന്ദികളെ പരിലസിച്ചിടും പരമ്പൊരുളേ നിറതിങ്കളും സൂര്യതാര തിരിവച്ചു കോപ്പുന്നു നിന്നു.
Thank you, Srimati Camilla, for the invocation. Let me now call upon Dr. A.K. Anil Kumar, Director, ISRO Telemetry Tracking and Command Network, ISTRAC, and Vice President, International Astronautic Federation, to formally welcome the guests for today's function. Dr. A.K. Anil Kumar is the founder of ICARE and serving as its chairman too. Sir, over to you.
Yeah, good evening to all. Respected Somnath sir, former chairman ISRO, Lida Jacob madam, Dr. Paul Augustine, and other distinguished guests and participants. As Anjana said, today is World Cancer Day, which is intended to increase global awareness about cancer. The concept of World Cancer Day was discussed at the summit that was held at the UNESCO headquarters in Paris on February 4, 1999. And this meeting has resulted in Paris Declaration, or called Charter of 2000, where it was decided that cancer care, research, and prevention need international measures. The Conquer Cancer Consortium is a collective of various organizations in Thiruvananthapuram dedicated to combating the growing burden of breast, oral cavity, and colorectal cancer. We firmly believe that by joining hands, we can make a significant difference. Our mission is to strategize sustainable and feasible solutions to reduce mortality due to these cancers. As earlier Dr. Rajiv was telling, it is about 30% is the mortality rate as of now. We aim to close the care gap by providing uniform quality care, appropriate training, and follow-up services. Our motto is to provide optimum services to all, ensuring equity. Our consortium is committed to organizing programs that are beneficial to the society, and this program is one of such a program in which we will discuss, we will do the awareness about the cancer detection and care. By forming this consortium, we believe we can amplify our impact and make a significant difference in the fight against the cancer. Let me come to my duty of welcoming the chief guest and other distinguished guests. Now let me welcome our chief guest, Dr. Somnath, former chairman ISRO. You all must be knowing him. There is no introduction is required for him. During his tenure, it was the Amritkal for space, ISRO, Indian space, and the Indian space industry as well. And we have achieved many great successes during his tenure. He is also he is the best person for inaugurating such a cancer care awareness program, as he also survived cancer, as he declared very publicly. He will be talking much about that. So let me welcome you, sir, for this function. Also, let me welcome Lida Jacob madam, who is the backbone for almost all type of charity activities, including blood donation forum. For this meeting, let me welcome you, madam. Also, let me welcome Dr. Paul, who is going to give a talk on regarding the cancer and its remedies and awareness programs. Let me welcome Dr. Paul also for this function. Let me welcome each and every one of you who are attending this particular meeting. And I can see about 140 people are attending online. It's a great success. So let me welcome each one of you for this one. And also let me thank all the members of this Conquer Cancer Consortium for arranging this online meeting. Thank you. Have a nice day.
Thank you, sir, for the warm words of welcome. Srimati Lida Jacob IAS, retired, former Principal Secretary, Government of Kerala, is currently the chairperson of All Kerala Blood Donor Society. She is also involved in training programs for the youth. She has kindly consented to preside over today's function. May I invite Srimati Lida Jacob IAS to deliver the presidential address.
Thank you. Good evening to all. respected Dr. Somnath. You are a very well-known personality in all over India and a great inspiration to all Indians, particularly to the young. Very happy that you are here today. Dr. Paul Augustine, the head of the Surgical Oncology RCC, and Dr. Ansar, National Service Scheme, the state officer, because we work with CAPS, that is the Blood Donor Society, works very closely with them. And Dr. Anil Kumar, who welcomed us all. Dr. Reggie Jose, director of Snehita, I heard her talk. And Camilla, who sang a beautiful song, though it was broken here and there. And my dear friends, I'm so happy to see that so many of us have come together on this very, very important day. As we know, the World Cancer Day, this February 4th, which is observed as World Cancer Day, started in 1999 in Paris and became an established feature ever after 2000 on. So this is 2025. And we have a very beautiful, a very, very strong theme for this year, that is United by Unique. It's very important. This is because fighting cancer is not just a medical problem. It needs the collaboration and participation of a whole variety of players, a whole number of different categories of players. That is why we need to be united. And the unique is also equally important, because the unique means each patient is unique. The doctors who deal with the patients having cancer will usually have to customize the treatment for each person, and that has to continue. And we need to have an approach of empathy, of compassion to the patient. It has to come. And we need to collaborate further in our society so that the awareness about cancer can be widely disseminated. Because we always speak about Bodhavalkaranam, awareness, but somehow it is just like water poured on the duck's back. But here we need real, deliberate awareness about this disease, because as we know, it has the incidence of cancer has increased alarmingly over the past few years. And they say that Southeast Asia is now becoming a leading center for cancer cases. And in Kerala, we know many doctors have repeatedly been saying that the number of cases is increasing, particularly and very sadly among the young. Therefore, it is very heartening that so many prestigious institutions, organizations, and associations have come together as a collective to face this and help the people who have to bear this disease. And we want them to conquer the cancer. I would like to mention that I've been associated with YMCA Trivandrum, though now I stay in Ernakulam. YMCA, YWCA Trivandrum, Ashraya, with whom I worked for a very long, and I still have my connections with them. Pallium India, of course, and our Blood Donor Society. And here we have residents associations which are part of this program, Center for Preventive Health, Care Plus, Inner Wheel Club, and we have Snehita and IMA Trivandrum, IDA Trivandrum, ISRO Women's Employees Benevolent Forum, Weissman's International, Solace Mission, number others. I think it is a wide variety of organizations working together. It only shows that this has to be and should continue to be a collaborative effort. So many important sessions are following, so I don't want to take your time. I'm very grateful to all persons who have come together here, because this is something which we have to face together. The awareness, which is very important, which speaks and which leads us to how we can prevent this disease, early detection, the treatment, the various forms of treatment, the new advancements and techniques and cutting-edge treatment techniques, treatment, research, and of course, palliative care. There are a lot of places where we need to understand the importance of these various areas of cancer care and prevention. I will not take much of your time. I am grateful that as the chairperson of the All Kerala Blood Donors Society, I have been given an opportunity to preside over this meeting, and I wish that all the organizations, all the associations and institutions will continue to work to bring health and well-being to many. Thank you all.
Thank you, ma'am, for sharing your valuable insights. Today, we have with us an eminent personality, Dr. S. Somnath, who was the former Secretary, Department of Space, Chairman, Space Commission, and Chairman, ISRO. An accomplished system engineer and launch vehicle specialist, Dr. Somnath had an illustrious career spanning nearly 38 years, which included positions of Director VSSC and LPSC and many others. He led ISRO in achieving missions of prestige and national importance like India's moon landing Chandrayaan-3, besides several others with PSLV, GSLV, LVM-3, SSLV, and RLV. He piloted the National Space Policy, Space Vision 2047, led the Gaganyaan activities from the front, and pioneered the development of Bharatiya Antariksha Station. ICARE Trust continues to enjoy his patronage. He has been bestowed with many prestigious awards, honorary doctorates, and is the Distinguished Fellow of reputed international societies of science and technology. I feel honored to invite Dr. Somnath sir to formally inaugurate the function and deliver the inaugural address.
Thank you, Anjana, for the introduction, and thank you for the opportunity to participate in the World Cancer Day observance organized by all of you. All the organizations came together and to have this day observed on 4th of February. I believe I am audible there.
Yes, sir. Yes, sir. Clear.
Okay. I would like to specifically thank Srimati Lida Jacob, Dr. Paul Augustine, who is delivering a talk today, who is the head of the surgical oncology of RCC, and also Dr. Anil Kumar, the chairman of the ICARE, and many other organizations who have joined hands together to have this web meeting of the awareness talk by Dr. Paul Augustine. I would like to also to thank each one of you who joined today, because you are becoming an ambassador of this awareness movement, which is very, very important. I don't want to speak much about the topic of cancer, because I myself have experienced it, and it has been a great exposure and experience. For someone who has not, seeing from outside, you have certain understanding, but once you go through this point, I think your awareness level is much higher, and you become qualified to counsel people who really go through this. So in fact, I become eligible from that point of view, which is a real fortune, so that I can, in a way, who really go through it, possibly the advices and help and experience sharing will really help them to overcome this, and look forward to such an opportunities in the future. But today, what is most important for us in the cancer awareness is to make people aware that it is very important to have early detection. I think this is the crux of the point, and the cancer can come to anyone at any point in time in life. It is possible. It doesn't differentiate various situations which you find differences. I think many of the origins of this are still being debated. What causes this? And there are many reasons people attribute. But of course, all of us know that it can be prevented. Occurrence can be possibly avoided by lifestyle changes. So we need to talk about possibility of prevention of occurrence through lifestyle changes, but it has its own limitations of the way in which we live in this society. The food, the air we breathe, the water we drink, and the exposures that we have may make us vulnerable to these situations. So, but however, as best as we can to minimize has to be done so as to create such situations. But the point I said again stress is early detection is the key. So whatever possible to enable people to go through this is most important. But this again is a huge challenge in our community, because the entire population, 140 crore people, cannot go through screening processes which will allow early detection in a systematic and timely manner. This is a huge challenge for a country like India. Only a very small percentage of people only have the fortune to go through screening camps of early detection. But then at least people should be informed and trained to understand symptoms, and possibly able to identify their own possibilities of having it, so as to go through a further checkpoint, which in my case, in fact, I had to do that. Even with all the medical support which I was visible to me it was not possible for people to detect it. Even I had symptoms for long months. Ultimately, I need to take my own call to do a certain checks and scan to identify it myself, possibly. It's not that I found out myself, but then I enabled that finding out at an early time. So this is the key, I think, people to be made aware of how to look for symptoms, which could be this. But then it doesn't mean that every symptom need to be a thing of scare for everyone. But once somebody is identified, they go through a trauma of the individuals as well as the family members go through this trauma, and we need to minimize the trauma and understand people to that today cancer at different stages can still be handled very effectively through various approaches. And awareness of this is equally important, that how to handle it and what are the possibilities of not to get misunderstood by various other forms of treatment and methods. How to approach the fastest and the more positive way of handling this such a disease is something that we need to make people aware of. But then the biggest challenge is still handling this disease cause financial burden to people, and how they can handle it, and what are the opportunities available for them to to handle resources and so that they don't go through a financial burden of significant manner. But this is a huge challenge for a community where there are different levels of income and financial support, etc. So this, of course, possibly the voluntary organization can in some manner help. And here again, the biggest challenge is again on the availability of medicines, and high-end cure still continue to remain as a costly thing. And how to bring down cost of access to the right type of care is also a point of concern. But then I told about the supporting people to go through this trauma is something very important. People who are experienced, who go through this, or who don't have an opportunity to go through and train, must help in a manner to support the families and the people affected so as to overcome this challenge. Then post-treatment, rehabilitation is also an important issue because people need to understand how to prevent continued occurrences and how to take care of their lifestyles and physical activity and many other elements associated with such occurrences is another point which need to be educated about. So there are many aspects of this cancer awareness. I believe such advices and talks by eminent people who go through this will really help it. And enough of material is available today to people to understand. Only thing is they should not be pulled into directions where there are other shortcuts and solutions, which will apparently become evident for people who fall prey to this. Should not happen, so that we take appropriate care and then also change your lifestyle so as to live peacefully for the remaining part of your life. And I want to thank all those people who have come together today to create this awareness. And with your blessing, let me say this program is inaugurated, and wish that we will have a very informed, educative lecture from Dr. Paul Augustine. Thank you for the opportunity and wish you all the very best.
So it was Dr. S. Somnath sharing his cancer survival story and stressing the importance of early detection of cancer without getting scared, and of reducing the trauma to the caregivers, of rehabilitating the cured, and reducing the cost of medicines as well. Let us salute his indomitable willpower. Thank you, sir, for those inspiring words. Dr. R.N. Ansar, Officer of State National Service Scheme, SNSS, leading a team of 5 lakh volunteers, has joined us today. SNSS upholds the need for selfless service. It provides a variety of learning experiences to develop a sense of participation, service, and achievement among the volunteers. May I call upon Dr. R.N. Ansar to say a few words. Ansar, sir.
Anjana, you please invite Paul sir to.
Oh, okay. So, moving on. Dr. Paul Augustine is Head Division of Surgical Oncology, Regional Cancer Center, RCC, Thiruvananthapuram, the premier institute in Kerala providing advanced cancer care to patients. He has a special interest in early detection of breast cancer in the community and has been instrumental in starting an NGO, Snehita Women's Health Foundation, which has been awarded international grant for the Snehita risk calculator for breast cancer. It is my pleasure to warmly welcome Dr. Paul Augustine to deliver the much awaited awareness talk. I request the audience to post the questions in the chat box while the talk is on. Doctor,
Hello.
hello. Okay.
Good evening to all of you. On and off. I think it's my network problem, or is it time for me to begin my
You can hear. You can hear.
It is not so audible.
talk? Or sorry for asking, but
It is audible, sir.
Doctor, you're
Please,
very
please.
well audible. Please go ahead. Very audible.
so it's time for me to
Yes,
start,
sir,
I
yes, sir.
suppose. I have been on
Sir, I think some network issues on your end.
all of you. I have heard what most of you have said. Today is the World.
Sir, one interruption. May I request all others to mute and switch off their camera? There is some bandwidth issue also.
Okay. So, what I would say is that we should be, what is awareness? What should we aware of? We need to be aware as to how we could avoid the problems due to okay, I'll off the video. Avoid the problems due to cancer. If we are to avoid the problems due to cancer, we should know the best thing would be to avoid cancer as such, but that is not always possible. Can we prevent cancer? Yes, certain cancers can be prevented to a certain extent only. There are vaccines like HPV vaccine for prevention of cervical cancers and to an extent oral cavity cancers. Then there is hepatitis B virus, which prevents hepatitis B infection, which could later on lead to hepatic cancer. As you all know, there are about 800 crore people in the world. And of these, every year, about 2 crore people get cancer. In India, there are about 140 crore. And here we get cancer in around 15 lakh people every year. In Kerala, we have around 3.6 crore people. And we have around 65 to 70,000 cancer cases every year. And unfortunately, of the 15 lakh cancer cases in India, almost 9 lakh die every year. That is quite alarming. Over 50% people die of cancer. Even in Kerala, the death rate is much less than what is happening in India, but it is quite alarming. And all this happens mainly due to the late detection. People present with cancer at a later stage. That is the main reason why people die of cancer. Regarding cancers, almost 85 to 88% of cancers are solid tumors. When you say solid tumors, it mainly means cancers of the lung, breast, colon, rectum, prostate, oral cavity. All of these cancers together form more than 50%. Then there are a number of other cancers which form the rest 30 to 35%. And then there are the liquid cancers, leukemia, lymphoma, myeloma, which form about 10 to 12% of cancers in adults. So our focus will be on those cancers which, if detected early, can be cured. So mainly the cancers of the oral cavity, breast, uterine cervix, and colorectal, one kodala. These 4 cancers form about 40% of all cancers, and these are the cancers that people should be aware of and try to prevent or detect early. Because if we treat these, we can be almost completely be cured. So first thing is to have healthy lifestyles by which we can try and prevent cancer. Healthy lifestyle is not a guarantee to prevent cancer, but it will help us to stay healthy, and it will help us to prevent certain cancers or postpone the occurrence of cancers to a later stage. First thing is to avoid tobacco products. Almost 35 to 40% of cancers in men are due to tobacco. And even in females, about 15% of cancers are due to tobacco related. Next is to maintain a healthy diet. Have a balanced diet as far as is possible, avoiding processed food and added sugars. Also, limit the consumption of red meat and have plenty of vegetables, fruits, and lean proteins. Avoid excess consumption of alcohol. And another important thing is to stay physically active. Staying physically active doesn't mean that you have to run around or do very strenuous exercises. It just means that you have to maintain a healthy weight, healthy waist-hip ratio, not be obese. And what is said is that we should have around 2.5 hours of exercise every week. That would be around 30 minutes of brisk walking every week, every day would be good. Then as far as possible, we should get ourselves vaccinated against the various diseases that occur. We have our vaccination policy. Regarding cancer, as I said, HPV is the added vaccine, HPV and hepatitis B. Hepatitis B is already there. HPV is a new kid on the table. The government has implemented or introduced this vaccine, and it is available very cheaply now. All boys and girls from 9 to 14 years should be vaccinated with HPV. And even if they are above 14, from 15 to 26 years also, they could be vaccinated with an extra dose. Even those who are above 26 may consider themselves to be vaccinated up to 45 years of age. But ideally, the vaccination should be before the first sexual intercourse, and the ideal age would be 9 to 14 years, or at least before 26 years of age. Then all of these, as I said, may not prevent cancers, and as we live longer, our chance of getting cancer is increased. So what can we do? We can only resort to something which would enable us to detect these cancers early. How can we detect these cancers early? Can we on our own detect these cancers? We'll stick to these 4 cancers. Oral cavity cancer, yes, to a certain extent we can. We will be aware of any difference, any ulceration or any thickening or any discoloration within our oral cavity. some mucosal problems. If we are a bit on the lookout for these things, we can, to a certain extent, find these out and approach our doctor. We should not be ignoring any of these early signs or symptoms, like a white patch or a red patch or a chronic ulcer in the mouth. The next is cervical cancer. Cervical cancer, as I said, we should get vaccinated as far as is possible. And in addition to that, Pap smear has been recommended for a long time. As of now, the recommendation is to have a Pap smear from 21 to 29 years of age, once in 3 years. And then there is something new. It is the HPV DNA, which can be done once in 5 years from 30 to 65 years. It's not a big thing to do a test once in 3 years or 5 years and to get vaccinated. Then the next cancer is colorectal cancer. For this, the recommendation would be in males and females from 50 years of age, have a stool or fecal DNA test once a year, if available. That is the best thing, or at least a stool occult blood test. That should be done once a year from 50 years of age to 75 years of age. And if possible, to go ahead with a sigmoidoscopy once in 5 years and a colonoscopy once in 10 years. That would mean 3 or 4 sigmoidoscopies or 1 or 2 colonoscopies in your lifetime. So these are the methods by which, these are easy methods, I think, by which you can detect these cancers. I've told about oral cavity, cervix, uterine cervix, and colorectal cancer. And now coming on to breast cancer. Breast cancer is one of the commonest cancers. It was the commonest. It is raising with lung cancer to be the commonest or the second commonest. Lung cancer is now the commonest. It's around 11.8%. Breast cancer is around 11.6%. So both are neck to neck. Both sexes taken together, breast cancer forms around 11.5% of all cancers. That is a high number. And you know that it occurs mostly in females. Breast cancers can happen in males also. 1% of all breast cancers happen in males. So it's 100 times more common in females. So we'll stick to early detection of breast cancer in females. In the West, breast cancer occurs in older females. The median age at which breast cancer occurs in the West is around 60-62 years. Whereas unfortunately for us here in Kerala, the median age is around 49 years. That means 50% of our females breast cancer cases are under 50 years of age. And almost 15 to 20% are under 40 years of age, and around 8% are around under 35 years of age. That is a very sad state of affairs. So usually you would have all heard doctors recommend breast self-examination and mammograms for breast cancer early detection. Mammograms do detect breast cancers, but the problem is mammograms can miss breast cancers in dense breasts. In the West, as I said, breast cancers occur mostly in older females. And as you get old, the dense tissue in the breast decreases and the fat increases. So it's easier to pick up microcalcifications and clusters with mammograms. Whereas in our young females, mammograms may not pick up these microcalcifications because of the density of the breast in the younger females. So what can we do? Well, another thing what we say is breast self-examination. Self-examination is good Now, there is another term for it, being aware of one's own breast. That is called breast awareness. Yes, females should be aware of their breast from an early age, from 18 years of age. And if they are aware of what is normal in their breast, they could perhaps find out what is abnormal in their breast. But usually, females will be able to pick up these lumps or changes in their breast when the disease is in stage 2 or early stage 3. And as we all know, once we pick up some disease, we have, all of us deny, especially cancer. We don't want to believe that it is cancer. So even if they pick it up, they'll sit on it for some more time, another 6 months. And by that time, it advances to the next stage. And that is the reason why most of around 50% of the females have to die of breast cancer. They come in stage 3 most of the time. So what can we do to reduce this and to pick it up at an even earlier stage? The only way to pick up breast cancers at an even earlier stage, and when that happens in younger females, only if they resort to examination by a health worker or a clinician, even when they don't have any symptoms of breast cancer. So the present recommendation is to have a clinical breast examination from 30 years of age for all females without any symptoms or family history or anything of breast cancer. That is for the normal risk person. From 30 years of age, at least once a year, and that would go on to up to 70 or 75 years of age. And when the clinician does, the doctor or the health worker who is trained to do it, does it, they should be able to pick up a lump which is around 1 centimeter or at least less than 2 centimeters. When a lump in the breast, a cancer in the breast which is around less than 2 centimeters is picked up, it has less likely chance to have spread to other places, and the chance of cure is in most cases over 90%. So here you get a big difference in the outcome. The death is decreased by 20, 30 or even 50% by this simple measure, or there is an attitude change. And if ladies resort to clinical breast examination by a trained person, we can detect breast cancers at an early stage. When the doctor looks at the lady, if he or she thinks there is some change or something has to be more, investigations have to be done, then they would have to go in for other investigations like mammogram or ultrasound or needle biopsies, and the appropriate tests will be done and cancers can be picked up at an early stage. So if people don't go to clinicians and if clinicians don't resort to this, this cannot happen. But are there enough clinicians in our society to do this? There are two problems. One, most of the clinicians are very busy. They can't examine all the patients who come to them. And unfortunately, most of the clinicians are not well trained to do clinical breast examination. This is not something which is taught during MBBS or even MD time. This can be the ability to do a proper clinical breast examination can be achieved only by seeing patients and doing it on patients and normal females. So there is only those who have been trained to do it can do it. And those who are trained means it is not necessary that we need to train doctors or we need to have doctors to do it. The easier way or the probably possible way would be to train health workers or volunteers to do these, female volunteers to do these clinical breast examinations. They may not be able to pick it up at 1 centimeter, but they'll be able to pick it up at least around 2 centimeters, which is good enough. We can get over 85 or 90% cure rates. Now we are getting only 50-55% cure rates. To get something like 85 or even 80% cure rate would be a huge step. So what we should be trying to do is to give the awareness that breast cancer, in order to be cured, should be picked up early. And in order to be picked up early, females should go for clinical breast examination from 30 years of age to someone who is trained in clinical breast examination. As I said, we could train volunteers, and these volunteers could be from their own society. If there is an apartment, a flat with 50 households, or there a colony with 100 households, a few from that place, maybe 10 or 12 or 15 from that place could be trained to do an examination in these ladies every 6 to 12 months. If they do every 12 months, there is high likelihood that they may pick up only bigger lumps. But if they do it once in 6 months, I'm pretty sure that all these females will come at an early stage, anyone who is having breast cancer. So the idea should be to have trained volunteers in the ladies' own community. Maybe for every 500 or 1,000 females, there should be 15 or 20 females who are trained, who could do a clinical breast examination. Not only a clinical breast examination, they could look into the mouth and advise regarding HPV vaccination, advice regarding the HPV DNA test, and advice regarding fecal DNA test and sigmoidoscopies and colonoscopies. So this awareness has to go. This doesn't cost anything. It is just the attitude and the awareness that we need to have. And if this happens, I'm pretty sure that the cost of cancer treatment will come down drastically, because we would be having most of these patients at an early stage. And getting patients at an early stage definitely reduces the cost of treatment, and the outcomes will be much, much better. So this is what we have to think of. See, regarding cancer, there are 3 things. One is prevention and early detection. The next is treatment. And the third part is palliation. Unfortunately, all the focus is on treatment, and treatment alone. And even in treatment, the focus is on costly treatment, which probably give less than 10% additional benefit. I would say in cancer care, 90% of the money is being spent for just 5 to 10% benefit. Unfortunately, administrators or some of the so-called experts are unaware of these things, and the public are totally unaware of these things. People think that the patients here are, people here are dying of cancer because of economic problems or lack of treatment facilities, or it is not that. It is mainly because we are not having a proper system and a proper primary healthcare system wherein these things can be tackled. And we have to have an attitude change as to how we can tackle this. Many a time, money is spent on so much of costly investigations which add nothing to the patient's final outcome. And many a time, so much of treatment is done on stage, at a stage when nothing much can be achieved with very costly treatments. And unfortunately, everyone wants costly treatment because they think if you put in more money, you get better results. That is unfortunately not the case. So what else can I say? I think I have talked for quite some time, and I don't know whether this question answers is permitted, but if the society, if people are to benefit, I think people should be asking questions, and I will try to answer those questions as best as I can.
Thank you, Doctor, for that thought-provoking session, throwing light on the statistics of different types of cancers, significance of early detection, screening periodicity, and vaccines available. Doctor has nicely explained the consequences of denials and postponing examinations due to fear and ignorance. He has also stressed on the importance of having trained medical professionals and volunteers for clinical examination at regular intervals. He has touched upon the palliation aspects involved in cancer care, in addition to the treatment modalities and the cost aspects as well. Hope we all take home the message you have conveyed regarding an attitude change that is required and contribute our part now that an alarming number of cases is getting revealed over the years. Now, I think we can have a quick Q&A session. So in the chat box,
one thing I should say, what can each one of us do? Each
Yes.
one of us should decide that I will go in for these recommendations. I will, and my family members will. What happens is we advise others to do these things. Let us do this. Let us do this and show others that we are doing it, and talk out to the society that we are doing it. Then others would follow. Mostly people organize things and advise others to do things. I am also now advising others to do this. But the main thing is that let us begin at home. Let us do these things. The recommendations are very easy for 4 cancers and very easily doable things. Let us do it. Let my spouse do it. Let my children do it. Let my siblings do it. Let my parents do it.
it's very true, sir. So leading by example is the key to key to cure or key to early detection too. So now I see a couple of questions in the chat box. First is with respect to when we should stop treatment and go for palliative care. This must be the question in many minds too. So the question becomes relevant because he has talked about the high cost involved for treatment, which is a big burden for at least a few sections of society.
See, everything is unique. Each cancer is unique. Each person is unique. Regarding whether someone should go in for some treatment or not depends very much on the type of cancer, the stage of cancer, what we should discuss, the options with the family. There are a lot of options. I can't say that you should be going in a Maruti car only when you have the option of going in a Mercedes or not, something. It depends. So we should be discussing what the patients and their families should be doing is ask the doctor their doubts. Many a time people don't ask. They just leave it to the doctor to do what they want. You should ask the doctor, doctor, if I take this medicine, what is the added benefit that I get? Will it cure my cancer? Or is it going to, how many months will I get? What is the cost? What is the added benefit? If I don't do this, what is it? I rarely see people ask that. People don't want to ask that. Then you can decide for yourself whether you want something or you don't want something. So everyone should take that responsibility for if they are patients or their near ones are patients, and you should discuss it with your doctor. You should ask questions, get answers. Many a time our people don't ask. They don't want to know. If you don't want to know, how can we force you to know?
Yes, sir. So each person, case by case only, we have to address the issues. It's clear to us. Now, one more question what I'm seeing is vitamin B12 high dose of vitamin B12, is it a symptom of bone cancer? It is asked.
I am
Sir,
not aware. I am not aware of that. High dose of vitamin B12.
yeah. So anyone else has some questions? Yeah, I'm seeing one more. If one has undergone hysterectomy, will it increase the risk for breast cancer? Another question.
Not really. Having just had an hysterectomy will not increase the risk of breast cancer.
Okay.
I think people should be asking more, not such specific questions. They should benefit everyone.
Yeah. Sir, one more also, what they asked is regarding fibroadenoma, whether fibroadenoma in the breast can become cancer in future.
Fibroadenomas don't as such become cancer. If you are sure it is fibroadenomas, they'll wax and wane and then even disappear on its own. Fibroadenomas don't sit there and become cancer.
Okay, sir.
Just one question, Dr. Lida Jacob here. I'm very interested in what you said about starting from the lowest level of healthcare in our state, like the public healthcare center. Could you just briefly, because I have seen a lot of work done, for other diseases, beginning, they take care in the initial stage itself. But for cancer, very briefly, you can just tell, what do you think should be the components of, cancer detection and early and awareness, etc., at the primary health center? Just a few pointers that could help.
First of all, we should have doctors at all times in the primary healthcare center. How can we have those? If, I don't know, I have never worked in the health system outside of RCC, but I believe that in the rural areas, doctors don't stay there as often as they should. I don't know whether their availability is there. So the first thing the government should be doing, or the administration should be doing, is to see to it that doctors get to stay there. They have their facilities. I think if the civil servants are sent to some place, they're taken care of at that place. And you are taken care of in such a good way that you will stay there. Doctors, I don't think, are taken care of in such a good way. And they don't want to stay there where facilities are not good enough for their kids' education or anything. So first thing is to make sure that proper doctors are there in those so-called rural areas who would be there with the people and cater to those. Then the number of people coming to a doctor. When a huge number of people come and people go to the hospital for simple fever, cough. So minor problems, people in our state rush to the hospital. So when such a big load comes, it will be difficult for doctors. Ideally, a doctor can see, we'll have to take at least 15 to 20 minutes for each patient. If that happens, then the doctor can just carry out the recommendations that I just said. Look at the mouth, advise them about the breast examination, the vaccination, the stool fecal DNA test, the HPV DNA test. Advise them about this, have a chart prepared for individuals, and see to it that they abide by those things. One other thing which can be done is that government institutions, when people are recruited into the system, the government can say that our officers should all be abiding by these things, because the state is giving so much of money, spending so much of money for the treatment and other things. So there should be a system wherein that people should be responsible to go for these tests or early detection things. It is not very hi-fi test that I'm saying. What usually happens is hi-fi testing and nothing will be picked up. Money will be spent. So first of all, enable doctors to be comfortable in where they are and be able to talk to their patients and give recommendations. Second, you bring in a system wherein people will find it something will be there for them to go in for these tests. Either some laurels or brickbats, whatever, accolades or punitive things. Something has to be there. Otherwise, it will not be easy to implement these things. We talk a lot, but nothing is done at the ground level.
Thank you very much, Doctor. Yeah. Thank you.
So shall I move on to next question? In case of family history of prostate cancer, what test is suggested as precaution? First.
See, prostate, you can do a PSA test. Prostate-specific antigen test can be done from 50 years of age. There is a recommendation for that. But these things, I don't think I should be sitting here and answering such questions. I don't.
Yeah, and another question is with respect to longest life expectancy for stage 4 lung cancer patient. That also is asked.
That also depends on the type of lung cancer, whether what mutation is present,
Okay,
what drug you can give for that. It depends. You can have a long quality life for a number of years if it is the right type of mutation for the lung cancer, even if it is stage 4. And if it is not, you may have only a few months. You can have from a few months to more than 5 years to even 9 years or 10 years. It depends on the type. Let me tell you, all cancers are not the same. And even within the same organ, all breast cancers are not the same. All lung cancers are not the same. It is all very unique. There are a lot of different types of cancers in each organ.
Okay. Sir, now we have a lengthy, case presentation here. Would you like to speak? Lakshmi, you are there? The case presented is slightly long. I was detected with stage 2B ovarian cancer at age 45. During surgery to remove the tumor, a frozen culture was done to detect, and it was detected that a portion of tumor was lying on top of colon. So in addition to, what is that? Colorectomy, I think. Hysterectomy, a portion of colon was also cut and removed. And since the bowel wasn't properly prepared pre-surgery, a colostomy was done, and I was wearing colostomy bag. There was no involvement of lymph node or invasion in intestinal lumen. 6 chemo sessions were there. And during that time, there was hernia around the area where colostomy was done. There was also discharge per vagina due to rectovaginal fistula formation. To fix this, I was referred to gastrosurgery department. They said that to reverse the colostomy, they will close the colostomy and do an ileostomy. A keyhole surgery was done, and ileostomy was done through same site of colostomy. Few days post-surgery, bowel paralysis occurred, and a second laparotomy had to be done for fixing that. So, tally of surgeries is 3. A few months later, it was found that colon was not patient, and so the ileostomy couldn't be reversed as planned. So another additional surgery was planned to remove the stricture and stitch the ends together to make colon patient. During that surgery, a complication arose. Okay, I think
That's
they're coming in. Yeah, renal
patent.
shutdown. You can, yeah. Renal shutdown while inserting catheter. You would like to complete Lakshmi? I could read only till this point. Not audible. You are muted.
Good evening. Good evening. Yes. So I'm in hospital right now. I'm still admitted. So the latest surgery that resulted in a renal shutdown, and so the next surgery that would be the 5th surgery was done to overcome that. So they put stents in my kidney, and so I'm just overcoming that. So actually, now I'm totally cancer-free, but what started out as a disease in the ovarian cancer, it's affected so much. So is that the case with all the patients, or is mine a very rare case? Is it my bad luck, or?
Lakshmi, I empathize with you. I hope you come out of all your problems. I can't tell from a distance as to what has happened to you. Doctors do things in good faith. It's not that every time it goes right, but people do it in good faith always. No doctor wants to have a complication. I understand that the ovarian cancer had, there was something onto the colon. That is why probably they took it out. And when they took it out, because they thought an on-table anastomosis or continuity in the bowel would not be proper at that time because the bowel was not prepared and it would have been obstructed and it would have been edematous or something. So they put a stoma, which is pretty okay. After that, somehow they were not able to close it as of now, at that time, and later they did something else, another stoma. These things do happen, and I think you still have a chance to have all the stomas closed and come out of that in the near future.
Thank you.
Okay, doctor, one last question. Should one do mammogram after 78 years of age, as well as pap smear?
There is no, well, mammogram is to be done till an age where you have 10 more years of fruitful life. That is a philosophy behind that. So in our state, for a female, the average age is around 78, 79. So that is why we say that you can do a mammogram till 70. In Japan, it is around 80 years, 80 years or 85 years. So a mammogram to be done means that you are trying to pick up a very early lesion, and then that lady should be having at least 10 more years of fruitful life. That is the philosophy. So whether you want to do it 70 or 70, 78 is a bit too much, I would say. The recommendation is still 70 or 75. And pap smear, no. Pap smear, as I said, we usually don't do it. It is 21 to 29 once in 3 years. Earlier, we used to do pap smear, but now there is HPV. You can do by HPV once in 5 years. If you don't have HPV, then you can continue to do pap smear till age 60 or something, not beyond that.
Okay, now I see some raised hands, whether they have some questions. Anyone else wants to ask? One more question, sir, in the chat box. Mammogram or ultrasound, which one is better?
See, ultrasound is not accepted as a screening modality because ultrasound looks at specific. It doesn't look at the breast as a whole, but ultrasound is useful. See, mammogram is the accepted screening modality, and it is useful when it is done in a breast which is not dense, an older age group. If a lady comes to me with a lump in the breast, and if I suspect cancer in that, if she's more than 40 years, I would straight away ask for a mammogram. Definitely for a mammogram, if she's 50 years and above, and even if she's more than 40 years, I would definitely ask for a mammogram. If she's less than 30 years, and I think it may be malignant, I would ask for an ultrasound. Between 30 to 40 years, it would depend on various other things. I may ask for either of these things. If I'm going to operate on this patient, if I'm pretty sure that this is malignancy and then I am going to operate on this patient for cancer, I would always get a mammogram. Or in some cases, if the breast is very dense, I may get a MRI. So this is all dependent on various things. It depends on the density of the breast and the suspicion of the clinician as to what the lump is. Many a time we do both. When we ask for mammograms, the radiologist would do an ultrasound also on the breast and axilla.
Okay, Thank you, sir. Anyone else has a question? I see 3 or 4 raised hands. Lida ma'am has a question, I think.
Sorry, I don't have a question. Thank you. I don't have.
Okay. Then on Arun Manchu, 2 people also I'm seeing. Sir, one more. Okay, that maybe somebody is asking what decides the density of breast.
Density of the breast is the only thing that mammogram. The fat is
Food,
black.
food. I mean, her specific question is whether it is food or anything else. I mean,
which causes breast cancer. The risk factor of breast cancer. Is that what?
breast density. I mean, that is what the question is framed. What decides? Is it dependent on food or any other?
Decides the density.
Yeah.
And density is decided by genetic features and the age. As you age older, your fibrous tissue in the breast is replaced by fat.
Okay.
And your genetic features will decide also how dense your breast is. And certain drugs can decide on density, decrease the density. Tamoxifen decreases the density. So those are all prophylactic. Those are all when you treat.
Okay. Thank you, doctor, for your patient answers and spending a lot of time with us.
Shall I?
So, yeah, one more. Okay.
Hi, sir. Actually, you explained the limitations of primary health center, something like government sectors. So, if we diagnose some cancers, how we will approach in a low financial setup? Because General Hospital, Taluka, we have a limited facility on cancer treatment. So, proper way how we will approach which facility, how systematic we are how we are going.
Let me say
Directions.
Regarding we have breast cancer as a prototype. Let me tell you, the outcome of cancer, breast cancer, depends on 3 things. One is how early it is detected. Second is the type of disease. What is the biology of the disease? And third is how well is it managed. So early detection we have already touched upon. Early stage, better the outcome. Then there's a type of disease. We'll have to look at the receptors, whether it is ER, estrogen receptor, progesterone receptor, HER2 receptors, those things, whether it is positive or negative. Based on that, our planning of the treatment would differ. Meaning that in certain bad biology diseases, if it is more than 2 centimeters, or if it is having a nodal metastasis, we would probably start our treatment with chemotherapy and then do surgery. All these things change the outcome a little bit here and there. In some patients, it matters much. In some patients, it would improve the outcome or improve the quality of life. So that planning has to be there. In order to do these investigations, the receptor status, we'll have to have a core biopsy. In order to take a core biopsy, you need a 14 gauge or 16 gauge or 18 gauge needle, and that can be taken with a gun or other devices, which will cost something like 1,500 to 10,000 rupees. And the investigations as such will cost, the ERPR, etc., may cost around 3,000, 4,000 rupees. The HER2 initial thing can cost the same, but if you have to do further tests like FISH, it can cost another 10 or 20,000 rupees. So those investigations will be basic and would have to be done. You don't have to go in for something like a PET scan or other investigations to rule out malignant metastasis, whether it has spread to other parts of the body, unless it is an advanced stage, locally advanced stage. What I see is many a time, even in very early stages, PET scan is being written. That may also because patients want it to be done. It doesn't mean anything actually. Doing a PET scan and saying that there is no cancer at this point of time elsewhere doesn't guarantee that it will not come the next minute, or finding out something is there by PET scan, this moment is not going to help the patient have a better outcome. The only thing is that she will be converted from curative to palliative. So I'm saying unnecessary investigations at times. Then the cost, these are the costs, and once you have these things, then surgery is the main treatment. And the initial surgery has to be proper. Surgery is to be done only after a proper diagnosis is done. Surgery is not to be done in order to get a diagnosis of cancer. We don't do surgery to excise the lump and then send it for examination and find out whether it is cancer or not. As far as possible, that should be avoided, because then in that surgery, mostly the lump will not be taken out properly, which will jeopardize the chance of proper cure. So many a time, the tumor will be cut through, which will increase the chance of spread. And the chance of optimal quality surgery will be compromised, mainly regarding the lymph nodes in the axilla. A situation where just a sentinel lymph node could have been taken may be not possible if an improper initial surgery has been done in the outer aspect of the breast just to excise a lump. So avoid initial surgery to diagnose a breast lump. Many a time that happens. A lump comes, people go in for surgery, take it out, then come back to us. Many a time it will be margin positive. We have to redo it. Another general anesthesia, so many problems. So the main thing is to avoid mistakes first. Then if it is early and good biology, we just need to have surgery and endocrine therapy. And if the breast is concerned, we'll have to give radiotherapy also to the breast. If the total breast is removed, early cancer, good biology, radiotherapy is also needed. Just surgery and drugs, which is not very costly.
Okay.
Did I answer your question, or do you want more clarification?
Actually, too many patients. I'm working in palliative care. Too many patients wandering different hospitals, and there is no guidance. They will spend too much money. Then again, sometimes at last they reach travel distance, manpower problems. Everyone they are sacrificing. So too much unnecessary treatments, not treatments. I'm seeing that difficulties. So someone is asking to me,
that's why I'm saying these things. Even
someone is asking to me, can I?
Many a time they are not properly managed. Many a time that is also a problem. It is not just awareness for the public alone. Awareness has to come in the whole profession also to a certain extent. How much you can how much of optimal appropriate things should only be done. Then only the financial situation has to be looked into, and then only you should order the investigations or do things. I know.
Thank you, sir.
Okay, doctor, one last question that is regarding the secondary cell formation. So the question is there any time frame? Will it happen or may not be in all cases? So what is your view?
The question is regarding metastasis, I believe.
Yes.
Spread of cancer from one organ to other sites of the body. What is the time frame for that to happen?
Yes, sir.
As I said, it differs in different types of cancer. There are very aggressive cancers wherein whatever stage you find out, it will go, and depending on the type of cancer, you can do nothing about it. There are very aggressive cancer. See, for breast cancer, even in breast cancer, the average time taken for one cell to become two to become, that's a doubling, tumor doubling, is around 150 days. That means by mutation, one cell is mutated and it becomes cancerous, supposing. It will divide and become two cells in around 120 to 150 days. But the time duration between the different types of breast cancer ranges from 20 days to 2000 days. Mind you. So the variety of cancers are so varied. On an average, it takes 120 to 150 days. So one cell to become two cell takes the same time. 2 to 4 takes the same time. So one mutation happens, and one mutation has to double 30 times to become 10 raised to 9 cells. And 10 raised to 9 cells is the number of cells in a sphere of 1 centimeter diameter. I said if you can find out a breast lump of 1 centimeter diameter, cure is possible in almost 90-95% of the cases. And if 30 doublings have to happen for one cell to become 10 raised to 9 cells, or one mutation to go to 1 centimeter, that is 30 into 150, which is around 4,500 days, which is over 12 years. So cancer is not as fast as most people think. There is a time period, but different cancers are different. I'm just saying about the usual good variety of breast cancer that comes to us. 60-70% of breast cancers are like that. And from that time, that is 10 raised to 9. And from 10 raised to 9, when it becomes 10 raised to 12 cells, it would have spread to other axillary nodes and all. And metastasis would have begun. And 10 raised to 15 cells is the time when it would have metastasized throughout the body and death is possible. So the time period of tumor doubling changes in different types of cancers. As I said, even in breast, the range is from 20 days to 2000 days, even though the average for 50 to 60% of breast cancers are around 150 days. So you can't just give a single straight answer for these questions.
Yeah. Sir, so these questions will be asked time and again. At this point of time, since there are no more questions,
we can give the specific answer to a specific patient when they sit in our OPD. We can't give a general answer for everyone.
Doctor, just as the person presiding over this, I just have to say one sentence. Only a person who has wide and vast knowledge like you have will be so ready and humble enough to listen and respond so beautifully to the questions the way you have today. Thank you very much from all of us.
Thank you. Thank you.
Sir. Yes, sir. Thank you once again, sir, for your understanding and patient answers. Let me now call upon Dr. Reggie Jose, Professor in Community Medicine at Sri Gogula Medical College and Medical Director, Snehita Women's Health Foundation, to propose the vote of thanks.
Respected dignitaries and dear participants, as we conclude this enlightening observance of World Cancer Day 2025, it is my privilege to express our heartfelt thanks to everyone who has made this evening a truly meaningful event. First and foremost, we extend our deepest thanks to Dr. S. Somnath, former chairman of ISRO, for inaugurating this event and sharing his inspiring perspective and personal experience, and also for a call towards a power of collective action. Your presence has elevated this significance of our gathering, sir. Our special appreciation goes to Srimati Lida Jacob IAS ma'am for presiding over this meeting, and your leadership and continued dedication to public service inspire us all to work harder towards our shared goals. And you are also heading the All Kerala Blood Donor Society, and that the great thing you are currently doing, ma'am. Then very happy to have you on board of Conquer Cancer Consortium. A heartfelt thanks to Dr. A.K. Anil Kumar, Director of ISRO, and our respected President of iCare for his warm welcome address and continuous guidance in this journey. We are immensely grateful to Dr. Paul Augustine from Regional Cancer Center for his comprehensive and illuminating awareness talk. Your insights into the latest development of cancer and prevention and what exactly need for all of us to do for our own family. That is you're also enlightened with your valuable knowledge and what we should be sharing with the community. That is very helpful for all of us, sir. And I also wish to extend my gratitude to to Dr. R.N. Ansar for his valuable presence and felicitations, because NSS is one of the organizations that is closely associated with Snehita and all the activities. And during COVID time, we have almost conducted 20 plus awareness sessions through the NSS team. So we are very close to NSS as well. So very thankful to you, sir. Maybe some kind of disruptions, we couldn't hear you talk. Your support and your support strengthens and resolve and encourages to push the further in this noble cause. And a small word about Conquer Cancer Consortium. For those who joined late, it is a collaborative network of organizations dedicated to raising cancer awareness, promoting prevention and early detection, and advocating for effective cancer care. And our motto is, together we can make a difference in the fight against cancer. And the participating organizations in Conquer Cancer Consortium are All Kerala Blood Donor Society, Astraya RCC Trivandrum, Association of Stomatologists and Maxillofacial Imagiologists in Kerala, ASMIC. They do oral cancer screening. Center for Preventive Health, Care Plus Trivandrum, Family Planning Association of India, FRAS, Federation of Residents Associations of Srikaryam, Indian Medical Association Trivandrum branch, Indian Dental Association Trivandrum branch, and the Women Dental Council of IDA. Then Innerville Club of Trivandrum Blossom, IK Trust VSSC, ISRO Women Employees Benevolent Forum VSSC, then Pallium India, Solace Mission, Weizmann International Trivandrum, YMCA Trivandrum, YWCA Trivandrum, and last, Snehita Women's Health Foundation. Sincere thanks to all of you on behalf of all the organizations in the consortium. And we sincerely thank all the members of the Conquer Cancer Consortium, Thiruvananthapuram, for their active participation and engagement. And your questions and contributions have enriched our discussions and strengthened our collective resolve. Thank you, Anjana, Scientist VSSC, Joint Secretary ICARE, for your effective coordination during the whole meeting, and also our technical team who ensured a seamless online experience. Thanks to Camila for your beautiful voice as the invocation, and all those who behind the scenes organizations who coordinated this event. We extend our appreciation for your meticulous planning and execution. I should thank Retish Sagadevan, the engineer from VSSC, who is a person behind coordinating and conducting this event on this World Cancer Day, because without his enthusiasm, we couldn't have. He encouraged me a lot, so that we should do something, ma'am, and we should do it collectively on behalf of Conquer Cancer Consortium, and that is how he coordinated all of us on this board. And thank you, Ritish, for that. And finally, thank you each participant who joined this evening. Your presence demonstrates that we are indeed united by unique. We all are unique, and and our uniqueness united us, and in our commitment to creating a cancer-free future. So thank you all, and good evening, and and good night.
So thank you, Dr. Reggie. With this, the event formally concludes. On behalf of the Conquer Cancer Consortium and my own behalf, I thank all those who participated in the meeting today. Let us pledge to unite together to address the ground reality, to create a world where we look beyond the disease and see the person before the patient. Together, we can create change. Thank you all. Thank you.
Thank you. Thank you.
Good night to all. Thank you.
Good night, ma'am. Thank you. Good night, sir. Good night, Somnath, sir.
Good night.
Thank you. Good night.
Thank you all. Good night.